Hey guys, this is Dr. Samir. So I'm going to thank you for joining me today for my Facebook Live. So today we're going to continue our talk on obesity, and this week we're going to focus on dietary therapies that you can do for weight loss and for obesity. And there's a lot of things that you can try, and there's a lot of diets that are out there to help out with weight loss. It can be confusing sometimes trying to know what diet may be the best, what works, what doesn't work, what's fad, what's not fad. And so in this lecture today, I'm going to try and discuss what actually works, what doesn't work, what are the diets that are out there, and what options you have to hopefully help out with some of the dietary therapies that we have for weight loss. So going back to our outline, in the prior couple of videos, we discussed what the problem of weight gain is, what contributes to weight gain, what do we do to get fat, and what could be done. And before we talked about lifestyle changes that you can do, and today, like I mentioned before, we will focus our talk on dietary therapy and dietary options. So when it comes to dietary therapy, there are a couple of strategies just in general that we have for our patients who are hoping to lose weight. Number one, it's important to learn about the calorie content of different foods. And you'd be surprised, a lot of people don't know exactly how much calories are in the foods that you eat, and people don't realize what are the contents of those particular foods that you have. And so a lot of people assume that what they're eating could be healthy, when in fact, it could be a content that's very high in calories, fats, carbs, or sugars that can contribute to weight gain. And that's why it's also very important to learn the composition of the foods that you have. If you don't know exactly how much fat you should be intaking in your diet or how much carbohydrates, that can make it very difficult to regulate that, and also make it very difficult to know what are going to be the best options for you. Doing something as simple as reading a nutrition label can be very difficult, and we can certainly talk about that in a future video. But just reading what a nutrition label is, understanding what a serving size is, and how much particular percentage you should be having for each food group, or at least with each component, is an important part for weight loss as well. Knowing what types of food to buy and how to prepare foods are vastly critical as well, because if you buy the wrong type of food or don't prepare it correctly, or prepare it in a way that can contribute to fat or weight gain, that will negate any type of benefit you may have from having a healthy food. So these are some very simple strategies that we use to help out with our patients to have them to achieve the best approach for the weight loss. Now, just in general as well, no one diet plan is superior. There have been a lot of studies comparing a lot of different diets: paleo, Atkins, Mediterranean, low fat, low carb. There's not been one single diet that's been shown to be superior for one particular person to help out with weight loss. They all pretty much work in various different ways. What's also very important, that diet alone is a very important factor for weight loss, but you need this in combination with exercise. It's very important to have the combination of the two. And the goal for any diet, no matter what diet you have, goes down in simple numbers. It really is that simple. You have to reduce the number of total calories consumed, or you have to increase the number of calories lost through exercise. That's basically it. If you take in more than you get rid of, you're going to gain weight. If you get rid of more than you take in, you're going to lose weight. But probably the most critical thing for weight loss is just adhering to a particular diet. And that can be very difficult sometimes. If you find a diet that works for you, and you actually are able to maintain the weight loss, adhering to that diet is critical to making sure that you can lose the weight that you want to lose and to maintain that weight loss as well. Too often people become too restrictive with their diet that it's very hard to maintain. And you can't live a social life with that, or you can't eat the foods that you normally want to do. And so making a diet that A, is effective, but also B, that you can adhere to, that's probably the most important thing you can get, or the most important thing you can do to hopefully lose the weight that you want to lose. So what are the plans that are out there? There are a lot of plans that are out there, and we'll be discussing some of them in today's lecture. But one of them is the low carb. It's a very common diet that people have. Sometimes it's it's almost like a paleo-ish type diet. But basically you try to minimize the amount of carbs in your diet. And for sure, people lose weight when you have a low carb diet. We know that eating a lot of carbs can contribute to weight gain. And also too, having a low carb diet can also achieve weight loss as well. In the past, it's been thought to have a low fat diet maybe an option for weight loss, but we're showing more and more studies that that's not necessarily the case. Fat may not be as big of a role in terms of weight loss or weight gain. And another option is calorie restriction. This is a very common approach for those organizations like Weight Watchers or Jenny Craig's. And this limits the amount of calories that you take per day. And for a lot of people who do this, is very effective. In fact, like I mentioned before, it's part of that simple formula of consuming less calories in will help you to achieve weight loss. The difficulty with calorie restriction is maintaining that and also having the discipline to make sure that you really follow up with that calorie restriction that you have, which is why Weight Watchers and Jenny Craig can be effective, because you're doing it in a group setting. And so you have the encouragement of other people to help you lose the weight that you want to lose. So when you do calorie restriction, usually you can even limit yourself to around 12,000 calories per day, and that can achieve pretty significant weight loss. But that calorie restriction is very hard to do. 1,200 calories, if you just look at an example, that includes one Big Mac, one small fries, and one small shake. And that's basically it. That is your whole meal for the entire day. And it's really hard to maintain a 1,200 calorie restricted diet, which is why it's very difficult sometimes to do a calorie restriction diet on your own without the help of an organization or without the help of other friends as well. Another very effective option that's out there, it's getting more and more press, is the Paleo Diet. Basically, the concept of this diet is that you have to basically eat what a caveman eats. So you eat mainly meats, fish, nuts, egg, and leafy vegetables. And the most important thing is you avoid processed foods. Now, paleo is used for a lot of people. A lot of athletes use paleo as well, especially athletes such as CrossFit. And the main benefit from this is that you really are eliminating some of the processed foods that can really play a havoc, not only with your weight problems, but also with GI symptoms, including IBS. And so by eliminating that, taking whole, really unprocessed foods that are very nutrient dense, can effectively help allow you to lose weight, in addition to minimizing the processed foods that's out there. There's also the South Beach Diet. This has an accompanying book and program with it as well. And this diet focuses on lean protein and also focuses on good carbohydrates, fruits, and whole grains as well, and also stresses healthy fats. And this is also a very effective diet for a lot of patients. It can be sometimes hard to do because there is meal planning involved and does involve preparing meals ahead of time. But for a lot of our patients who are trying to find ways to lose weight, instead of trying to go to the nearest McDonald's, if you have the food ready ahead of time, that's healthy, that has good carbohydrates and good fats, it's a very effective diet. I have a lot of patients, a lot of friends who've done very well on the South Beach Diet, and it's a pretty effective option. And it allows you to live, or at least eat, a somewhat of a normal type of meal. And there's the Atkins Diet. The Atkins Diet got a lot of press a long time ago. And this is one of those fad diets which we found. And this is also similar to other diets in the fact that it was a low carbohydrate diet, and it tended to stress more fat, protein, and fiber. The problem with the Atkins Diet that came out before is that the weight loss was not as effective as initially thought, and it's very hard for some people to adhere to this diet. It's a tough diet to have. Having a lot of fat, protein, and fiber sometimes just doesn't feel very good. And there have been some concerns about increasing risks for cholesterol and heart disease as well. And so the Atkins Diet had a lot of supporters a couple of years ago, but more and more people are realizing that the weight loss with this may not be as effective as some of the other diets that are out there. Now, this is a diet that has been gaining a lot more press and a lot more people doing it. It's a Mediterranean diet. This is a diet that's very high in a lot of fats, olive oil, legumes, and unrefined cereals. You have a lot of fruits, veggies, fish, and dairy products as well. It's a diet that's very common in the Mediterranean area around Spain, Portugal, and places like that. Now, this diet so far has been shown to be very effective for a lot of medical conditions, including weight loss, but there's been a improvement in IBS, an improvement in heart disease, diabetes, and it's a pretty effective diet to not only to maintain, but to allow us to have healthy goals and healthy means as well. And this has been a very good diet, and it's a diet that I would recommend to a lot of our patients who are trying to not only lose weight, but to also have a heart-healthy diet and to make sure you're able to have a diet that can affect some of the problems that you have. And this diet has actually been shown to help decrease both cholesterol and heart disease. But no matter what diet you choose, the most important thing is to keep track and keeping adherence. And these are some simple tips that I recommend for my patients who are trying to implement a diet plan, who are hoping to lose weight. And you can use this with any diet plan that you have, whether you want to choose Paleo, Atkins, Mediterranean, low carb. As long as you find a diet plan and stick to some of these simple rules, you can be pretty effective in terms of not only gaining weight loss, but maintaining that weight loss. But number one is actually keeping a journal of what you eat and what you do. You'd be surprised how this action alone is very effective to help you lose the weight that you want to lose, but also to understand what exactly you're putting into your body. A lot of times we're eating just left and right. We don't realize exactly what we're putting down, but once you take the time, either on an app or in a journal, and write down physically what you're eating, this will bring a mindfulness to your eating habits, which is critical to not only achieve weight loss, but to maintain weight loss as well. And I have a lot of my patients try to keep some sort of diary like that. There are apps that are out there that you can use which are very effective, including MyFitnessPal or Lucid. I've had friends who've used these apps just to keep track, and keeping track alone has been shown to help decrease or improve weight loss. So it's important to set specific goals, specifically behaviors. So you can set a goal of, I will drink 8 ounces of water before I have my first meal, so you can feel fuller quicker. Or I will exercise 30 minutes per day, and actually specify exactly what you're going to do. The more specific you are, the more effective the behavior will be, and the more likely you're able to lose weight because of that particular behavior that you have. And it's very important to track these as well. Because without knowing where you're going, without seeing a roadmap or a progression of how you're doing, it's very hard to maintain that motivation, which is why these apps are very effective. If you have an app like MyFitnessPal or Lucid, and you have a certain goal that you have, and you put the steps that you're doing to achieve that goal, whether it's keeping track of what you're eating or keeping track of your activity, you see progression from that. That provides a pretty significant positive reinforcement to help you lose the weight that you want to lose and encourage you to lose even more weight. And so what I found for a lot of our patients is that doing these things, these simple things, will help you lose the weight that you want to lose. And keeping track and setting goals and seeing the progression are very effective ways to help out with any diet, no matter what diet you choose to help you lose weight. So some of the strategies, is to focus on the goals. Why are you trying to lose the weight? Have motivation that's there and understand that motivation so you can help lose the weight that you want to lose. Plan your meals and plan your activity. The biggest reason why people don't adhere to a weight loss plan, or a biggest reason why people fall off the wagon, is because they don't prepare ahead of time. It does take some preparation to cook the meals that you want to have the snacks ready that are healthy, that are going to help you promote a better eating habit. It can take some time to do, but it is very important to help you lose the weight that you want to lose. Develop a reminder system. Have some ways to remind yourself of what you're doing, how you're doing, and to achieve the weight loss goals that you want to lose. Anticipate some of the temptations you may be having and plan some resistant patterns. I know for me personally, I get very hungry around 3 or 4 p.m. And so at that time, at my desk, I have a healthy snack that's there. I have some beef jerky that's there, and I know that I can use that to help me feel not as hungry and to allow me to feel full around that time. Plan these strategies ahead of time so that you're not finding yourself scrounging your food and then going to the nearest vending machine to find something that may not be as healthy for you. Reward yourself. If you do a good job, have a cheat day. I mean, seriously, if you enjoy yourself, you do well, just have one day where you have something sweet. Go get some ice cream, go get some cake, have a cheat day. I always have, every night I have every week I have a cheat night in which I just go crazy on food, and that's perfectly fine. Reward yourself. Don't be so hard on yourself, and just if you do something good, get a reward from that. And it doesn't have to be food. So don't keep in mind you have to reward yourself with food. If you're maintaining a diet for quite some time, get a nice gift for yourself. Treat yourself. Do something good so you can at least know that you have something to look forward to the next time you achieve that particular goal. Limit quantity. So if you feel the urge to have something sweet or have something that's not good for you, have it, but limit how much you have. Don't eat it all. Don't overindulge in it. Limit to what you have. Have it if you need to, but limit it. And have confidence in your ability to succeed. Not all of us are going to be able to maintain a great diet 100% of the time. There are going to be days which are good, days that are bad. There are going to be days that are fantastic. There are going to be days in which you're just really just totally messed up. And that's okay. You're human. It's okay to have those days. The most important thing is to try to get back on that diet and do the goals that you need to do. And then lastly, develop self-talk. If you do a good job, say you do a good job. Reward yourself. Just have a good attitude about losing the weight that you want to lose, because having pessimism, or at least not having a good attitude, can be very detrimental in having you to try to achieve the weight loss that you want to lose. So in summary, there are a lot of diet plans that are out there. It really, to be frank with you, a lot of them are very effective to allow you to lose the weight that you want to lose. And there's not one plan that is more effective than the other. But the most important thing is to pick something and adhere to it. Make sure you stick to whatever diet you want to stick to, and track your progress. Keep an eye on what you're doing, log your foods, log your activity, and see the progression that you're making, and determine specific goals. See exactly how much you want to lose per day, per week, how much you want to exercise per day, per week. Set that goals and make them be as specific as possible to help you lose the weight that you want to lose. So I want to thank you guys for listening to my lecture today. And so next week, we'll be talking about some of the medications we can offer for weight loss. And then after that, we'll talk about surgery and then endoscopic procedures that we can do for our patients who are having difficulty with weight loss.